Good morning, everyone. My name is Don Mosman. I'm a master instructor here at the North Dakota Safety Council. And thank you for joining us for our third of 8 free school webinars related to COVID-19 safety that we are doing in a partnership with DPI and several other organizations. We would like to remind you at this point that your video has been disabled. Make sure your microphone is muted, and all of the questions that are going to pop up, we just ask that you submit those through the Q&A feature through the Zoom webinar. And we are going to be pausing at different points throughout the session to answer your questions as they come in. And then the last hour of this webinar will be a subject matter expert Q&A. So we'll have experts from the Department of Health, from DPI, from Sanford Medical, and several other organizations that will answer all of your COVID-19 related questions in a live Q&A format the last hour of our session. So please stick around for that. Give you the opportunity to get direct answers from the experts in all of their respective fields. So our presentation this morning is one of 2 formats. We have the classroom format, which is this morning, and this session is really designed for teachers and principals. And then this afternoon, we're going to have more of an operations-directed webinar. And that one is really designed for superintendents, transportation, and maintenance folks. A lot of the pandemic COVID-19 response-related information that you're going to get today is also going to be covered in the session this afternoon. But there are specific things that we're going to cover this afternoon that will not be covered this morning. For example, school buses, HVAC systems, things of that nature are all covered in the afternoon session, not the morning session. We would like to thank all of our partners that came together to make this presentation possible, especially EAPC, Architects and Engineers, who they are going to be presenting and giving you some really cool things to think about with regards to functionality within the school, some new products, some design considerations, and things that we may look to in the future. So we'll be hearing directly from some of the EAPC staff later on in the webinar. But we partnered with all of these organizations, including the Department of Public Instruction, and all of the information that we give you is from the Department of Public Instruction, the North Dakota Department of Health, CDC, and the National Safety Council. And this is based on the information that the DPI initially put out with their K through 12 reopening document that they distributed to all of the schools in North Dakota. And they have another follow-up document that's going to be released that's even going to go into more detail about reopening here in the very near future. So for those of you that aren't familiar with the North Dakota Safety Council, we are a private nonprofit organization, and we are a chapter of the National Safety Council, which is the largest safety organization in the world. There are 21 U.S. chapters, of which we are one of them, and we are a safety training organization. That's what we do. We have approximately 940 member companies that utilize us for services. And we also have 66 school districts that are members. And we teach 4 basic categories of safety. The first is community protection, which is what this falls under. So under community protection, we teach school violence prevention, house of worship violence prevention, workplace violence prevention, emergency planning. We write emergency response plans and pandemic response plans for businesses and schools. And then we also do COVID-19 assessments and training. Traffic safety is all of your driving programs and driving courses like DDC, Alive at 25, which is our teen driving course. Emergency care is first aid, CPR, AED, trauma and triage training. And then occupational safety is things like OSHA, MSHA, which is mines, heavy equipment, and construction. So those are the four basic departments that we have here at the North Dakota Safety Council. So here is an overview of the topics that you can expect to hear from today. Exposure to COVID-19. So we're going to talk about people that are diagnosed with COVID-19. So if you have a staff member or a student that's diagnosed, what are we going to do? What's the processes? How is that going to work? And including people that have close contact with those individuals. We're going to go over the North Dakota color-coded health guidance system, which the state of North Dakota implemented the first week of May. We have actually departed from the federal phase-in reopening system, and we have our own color-coded health guidance system. We're going to cover the school decision tree that was published by the Department of Public Instruction. We're going to go over the basic biology of COVID-19 and how it interacts with its environment. Then we're going to have risk reduction practices. So this is where the rubber kind of meets the road. We're going to talk about masks. We're going to talk about physical barriers, temperature checks, movement of people, space considerations. The thing for all of you to remember is that this is not one size fits all. In other words, many of you are going to have, local decisions and even beyond that, even classroom and or school decisions that you're going to make based on the totality of the circumstances. A lot of the things that we're going to give you today are nothing more than suggestions and best practices more than they are requirements. But if the color changes, right, based on the color-coded health guidance system, there will be additional requirements that not just schools, but also businesses may have to do. So, but a lot of it's going to come down to local decisions. And so we want you to take all of the information that we're going to give you to be able to make those decisions on a local level. We're going to go over cleaning and disinfecting, some of the learning barriers that you may have as a result of the previous time period where we were in distance learning, and now all those students are coming back. We have also developed a risk assessment tool along with the North Dakota Department of Health that you can utilize to basically assess your own risk as a school. And that tool was emailed out to all of you. EAPC will do a virtual walkthrough of a school. So we're going to go into a virtual reality school later in the session today. We're going to actually walk through auditoriums, classrooms, hallways, cafeterias, offices, and look at what some real world solutions might look like in some of those areas and some of the new normals that we may have to consider as we move forward. And then we're going to give you a list of resources that you can utilize as you try to implement some of these different changes in the coming weeks and months. So the purpose of the webinar, right, is to present critical safety information, best practices, and some new ideas. We've been doing training on COVID-19 since March. We partnered with the Department of Health to provide COVID-19 safety training to businesses first and now to schools. And if it's one thing that we've learned a lot of lessons over the last few months, and one of them is that information is going to change almost on a daily basis. The CDC, for example, has released information on one day and then literally within 24 hours changed that information. So it's critical that you keep abreast of what's going on and keep in contact with all of the local resources, state resources, and national resources as things continue to change moving forward. But we want you to then take all of this information and then make local decisions based on what you feel will serve your students and your community the best. There is not one size that fits all to many of these questions that you all will have. So my name is Don Mosman. I'm the master instructor here at the North Dakota Safety Council, and my background is in law enforcement and specifically emergency response and emergency management for businesses and schools. So I sort of specialize on helping businesses and schools design emergency plans, train staff on how to respond to various types of emergencies. And then later in the session, John Wutot, our emergency care first aid program manager, is going to be coming on and teaching a section of the webinar as well, and he will introduce himself at that time. So we are basing this information on the North Dakota Smart Restart program. The recommendations put forth are designed to meet the goals of ND Smart Restart and guidance from the Department of Public Instruction. And again, we want you to continue to monitor resources like ndresponse.gov to keep up to date on things as they change and as things change in the future. Now, we are using the Zoom webinar function, which is slightly different from Zoom meetings. And in this format, rather than the chat function, we would like you to submit your questions using the Q&A function on your screen. So please submit those questions. And again, after each basically topic area, we're going to pause, answer questions that you might have. And then if it's a question that we believe is more suited for one of our subject matter experts to answer. For example, a lot of the direct COVID-19 health-related questions, we might hold on to many of those when Dr. Saxon from Sanford Ahmed joins us later. So we may hold on to some of those questions for that last hour, kind of depending on what the subject and the topic might be. So we're going to start off with exposure guidelines for staff and students. We start with symptoms. First and foremost, right, you have to have a reporting procedure for your staff and your students if they should exhibit symptoms or test positive for COVID-19. So first of all, if a student or a staff member is exhibiting any of the COVID-19 symptoms, and there's a laundry list of those symptoms that are available on the Department of Health and ndresponse.gov website. A lot of those, of course, are flu-like symptoms, fever, sore throat, other symptoms that are of that similar nature. We want those people to stay home. We don't want them to come in the building. If they still have symptoms after 24 hours, they should then contact their family physician. If they have no symptoms, they can go ahead and return. So, for example, somebody may have a sore throat due to allergies. We still want them to stay home, but after 24 hours, if that's the only symptom they have and they have no other symptoms, there's no problem with them returning. But if that sore throat persists or if other symptoms develop, they need to contact their family physician at that point, and then the doctor will give them advice on what they should do. So if you have a staff member or a student that has been diagnosed or tested positive with COVID-19, first of all, if we get that test result while that person is in the facility, then we need to facilitate them going home immediately. They will be required to self-isolate for 10 days from symptom onset. So from the time that the symptoms begin, they need to self-isolate for a minimum of 10 days. If they're asymptomatic, 10 days from the collection date of their test, they need to self-isolate. And then they must be 72 hours COVID-19 symptom-free without the use of any fever reducers in order to return. So if that 72 hours happens to fall into the last 3 days of that 10-day window, that's okay. In other words, we don't need to add 72 hours on top of that window, but they have to have that 72 hours symptom-free without the use of any pain medication, fever reducers in order to return. And then everyone in their family that lives at their home will need to quarantine at that point. Following the diagnosis, the North Dakota Department of Health will be contacted immediately. Usually that's done by the doctor's office, but should you be contacted by a family member, for example, and say, hey, my son or daughter just tested positive for COVID-19, you're going to want to go ahead and notify the North Dakota Department of Health just in case they didn't get that notification from the doctor. The area in which the person worked or spent significant time, for example, a classroom, should then be shut down, and anyone who has had close contact with that person should also be sent home. Now, close contact is defined as within 6 feet. So that 6 foot perimeter, that social distance perimeter that everybody has had ingrained to them since the start of the COVID-19 outbreak, for 15 minutes or more. Okay. So anybody so if I was in the same room with this person, but we were 30 feet apart and, we didn't meet that definition of close contact, right? Then that's not going to impact me. It's only people that have had that close contact under that definition. Then the Department of Health will work with the school to assess the degrees of contact within that person's area. So they're going to basically trace where was this person, how long were they in these spaces, and what other people might have been in these spaces with that person. And then based on that information, other people may be required to quarantine due to contact. We're going to close off areas used by the person who was sick. If we have the ability to do so, we're going to increase air circulation. So if the doors and windows to that area can open, especially to the outside, we're going to do that. We're going to wait 24 hours before we start disinfecting. It's just going to make it's safer for the person or persons that's going to go into that space and start the disinfection process. And then once they go in, we're going to make sure that they wear all the proper PPE based on personal protective equipment. For example, gloves, maybe eye protection, a mask, and it's going to be based on the requirements and suggestions of the manufacturer, for example, of the chemical that they're using. And if 24 hours is not possible, we're going to wait as long as we can before we start that disinfecting process. And for some of you, that may be your local maintenance staff that does that, or in some cases, you could hire a third-party provider to do that disinfecting. If it's been more than 7 days since the person who was sick visited or used that space, then additional cleaning and disinfection is not necessary, because obviously that's plenty of time for the virus to die on its own. So what is quarantine, right? What does that actually mean? Quarantine is for people who are not showing symptoms of illness. It's used to keep keep someone who might have been exposed to COVID-19 away from other people. Someone in quarantine stays separated from other people, limiting movement outside of the home or facility where they are staying. Okay, that is quarantine. So if there is a person that has had that close contact, and again, remember, that is within the 6 foot window for more than 15 minutes, then this person is going to be required to quarantine for 14 days from the date of the last contact with that person. And then that same 72-hour symptom-free, no medications return guideline, that applies to these people as well. Now, for other people, for example, if I had close contact with a person that had close contact with that COVID-19 positive person, there are no requirements for me, right? The only people that are going to be asked to quarantine are the people that have had close contact with the people that have tested positive or have known to have those symptoms. So For everybody else, there are no isolation or quarantine requirements. So some of the basic steps that we want to look to when a student or staff member has become symptomatic or diagnosed. First of all, we want to identify an isolation room or area. This is in the DPI guidance to separate anyone who exhibits COVID-19 like symptoms, or we learn that they've tested positive. So if somebody is exhibiting those symptoms and they're in our building, we need a space in our building designated to take them so that that's where they will wait until they actually leave the building. So we don't want to leave them in the classroom. We don't want to have other people exposed to them. So we're going to want to have a place where we can temporarily house them away from other people until they can be transported. As soon as those people are exhibiting those symptoms, or anybody that has close contact with that person, we're going to want to have masks available and place masks on those people. So, for example, if there's a staff member who is going to attend, it could be a school nurse as an example, or another staff member that's going to attend and be in that room with this person, we definitely want a mask on that person. You're also going to want to place a mask on the person that is being treated or is being moved to that isolation area exhibiting those symptoms, right? We want to reduce the possibility that those droplets are going to be expelled when we take them from, for example, a classroom to that self-isolation room. We want to be mindful of siblings at other schools. So immediately we're going to want to contact if they've got younger or older brothers and sisters that might be in other schools in our district that have lived with this person and obviously had close contact with them. We're going to want to be mindful of that and notify those people and those buildings immediately. Establish procedures for transportation home with a parent or guardian. So you're going to want to have almost a checklist or a written procedure that, okay, once that person is identified, they're exhibiting symptoms or they've tested positive, we've isolated them in the room, the space that we've created. What is the procedure then for them to go home? For example, when somebody stops to pick them up, right? We want a procedure to take that person from the room to meet the parent. We want to limit the exposure to other staff and students as much as possible. So, for example, hopefully we can have that room somewhat close to an entrance area where we can get them out of the building relatively quickly without exposing other people. And then you want some recommendations for once they get in the vehicle. So, for example, if mom or dad or parent or guardian is driving, then you want to recommend that they place the student in the back seat if at all possible, to try to create that social distance even within the vehicle, and hopefully both of them have masks on while they're in the vehicle. Notify state and local health officials, your staff, the families involved immediately of a possible diagnosis while maintaining confidentiality. No one should return to school until they've met that CDC 72-hour criteria. And we're going to constantly monitor if you have a school nurse or even other local health providers. We want to look for trends. So, for example, how many students have either not come into school or maybe left school with flu-like symptoms or COVID-19 symptoms over the last week, over the last 2 weeks, 3 weeks. We're going to try to look for trends. And then if we notice that there might be a trend forming that might indicate an outbreak either within the community or within the school, then we're going to reach out to the Department of Health for possible guidance. So things to consider with that symptomatic person or student, right? We're going to want to place a mask on them as soon as possible. An N95 respirator would probably be appropriate for those persons caring for this person until they are removed from the property. So that nurse or that staff member that is going to have that close contact with that individual, instead of a cloth mask, we might want to have an N95 respirator available for those people. We're going to implement our exposure and disinfecting plan, just as we've talked about. Students who call in sick, any information regarding symptoms is valuable for awareness purposes. So when in this kind of new normal that we're in, we're going to need to educate and train our admissions people, our folks that work in our front reception area that kind of deal with student absences, that we want them to have basically a guideline on questions to answer, like what symptoms, not just, hey, my student is sick and they're staying home. What symptoms are they exhibiting and how long have they been sick? We want some basic questions to be answered so that we can kind of get some baseline information and look for trends within our student body population. Ensure that any symptom tracking is done with privacy concerns. So we want to track symptoms, not names. Be careful not to create an additional medical record. So for example, we don't need to create a record that's, 10 student names and what are the symptoms of all of these students. What we want to do is say, okay, 10 freshmen all reported exhibiting flu-like symptoms, right? That's all of the information that we need. We don't necessarily have to put names with specific symptoms in order to have information that we can track. Okay, so we do have one question that says, how do we get fit tested for N95 masks? Well, actually, you can do that through Sanford Achmet. You can also set up fit testing right here with the NDSC. We work with Sanford Achmet for fit testing. So, but I think your first outreach should be to Sanford Achmet, and they will, of course, they have locations throughout the state. And most of the other health providers like Trinity, Altru, and Grand Forks, they will all have their occupational medicine clinics will all have fit testing available. So that would be my suggested resource for all of those. Okay, we have a couple more. Keeping privacy of individual or creating an isolation room seems like a tricky situation for smaller schools. This question comes from Dave. Would like some ideas on how to ensure that privacy. I'm assuming, Dave, that you're kind of referencing, for example, a student becomes symptomatic, and then now as we, are moving that student to a room, or maybe other students see that student being moved, are there any, privacy considerations or possible questions that might arise? I think that'd be a great question for our DPI expert later on. So we're going to hold that question for them. And then, are the N95 masks going to be sent to the schools so they have them? First of all, an N95 is not a mask, it's a respirator, and there is a big difference. And we're going to be talking about that later. But again, we'll let DPI, I don't know if they have an internal, or if partnering with the Department of Health, whether they have an internal plan to distribute any N95 respirators specifically to schools. So we will ask that question of them. So we're going to hang on to both of those. So now let's cover your school decision scenarios. This was in the DPI document that was released earlier. So first of all, there are 4 basic scenarios. Scenario number 1 is there are no cases in your community. We actually have several counties in North Dakota right now that have no cases in the county whatsoever. The Department of Health, under this circumstance, does not recommend any school closures, and you're going to follow the basic prevention guidelines in the North Dakota K through 12 Smart Restart guidance that DPI distributed back in May. Now, those basic guidelines and prevention tools are these. In other words, it's important to remember that even if you don't have any current positive tests in your community, there are still prevention tools that DPI and the Department of Health want you to practice to prevent those cases from coming into your school. So this is what those minimum prevention tools are. First of all, teach and reinforce healthy hygiene. We're going to give you some more specific tips on how you do that. Use masks when social distancing is not possible. Now, right now in North Dakota, other than healthcare providers, there are no mandatory mask requirements for cloth masks, for example, out in public or other areas. However, as a general rule, when we can't social distance, and I'll give you an example. If you have a staff member that is working with some sort of a special needs child, and they do an activity that requires that staff member to sit right next to the child for an extended period of time, where we might have to surpass that 15-minute social distance guideline. And if that's the case, and even as a best practice, even if they're sitting next to them for, let's say, 5 or 10 minutes, it would be a good prevention tool to have both the student and the staff member have a cloth mask. Limit unnecessary staff and visitors to your building. You know, the fewer people that we have come into the building, the less the exposure. So the idea there is that people that don't have a need to come in, a critical need to come into the building, if we don't allow them to come in, it reduces our exposure. And we're going to talk about that more in detail later. Increase communication with staff and students. Intensify cleaning and disinfection. We're going to limit sharing of anything. So any type of piece of equipment, anything, even things as simple as pens and pencils, things that students have to share, we want to try to limit that if possible. Now, there are going to be times when you can't limit that. And in those times, can we disinfect it? Can we wipe it down? There's going to be other, and again, we're going to go into a lot of detail later in the webinar about some ideas for that. Check for signs and symptoms, monitor for absenteeism, consider postponing non-critical gatherings and events, so things that we don't have to have, where we have large groups of people together, it will reduce our risk. Requires 6 students and staff to stay home and make a plan for when a staff member or a student becomes sick. So these are the prevention tools that we're going to employ, right, no matter what the case level is in our community or statewide in North Dakota. Scenario number 2 is there are cases in our community, but not in our school. So this is actually going to apply to every school when they first reopen, right? There's going to be a lot of places, counties, and cities that there are cases, but not in the school. So in this situation, the Department of Health does not recommend any closures, right? School leaders should follow the procedures outlined in the K-12 Smart Restart Guide. And then the Department of Health may recommend that schools close to reduce spread. In this event, the North Dakota Department of Health will work closely with the school and community leaders. So if there is an isolated incident, and as an example, what happened in Sioux Falls, South Dakota, where you had an outbreak within the Sioux Falls community. If that were to happen in a town or a city in North Dakota, even with no cases in the school, as a proactive measure, the Department of Health may contact that school district and ask them to close for a temporary period of time to reduce the spread of that isolated event. So that's scenario number 2.
There we go.
Scenario number 3, the Department of Health will notify the school, and this is, again, a case in the school. So we have a student that is tested positive within our school. We're going to get notified by the Department of Health. The school becomes aware of the COVID-19 case, or if you become aware of it before the Department of Health reaches out to you, you should contact the Department of Health immediately. For example, if you're notified from a family member or a parent or guardian. The school should close for at least 72 hours following a confirmed COVID-19 case of a school employee or student. And again, it's should, right? That time period is not mandated. That's a recommendation. School personnel should conduct then a thorough environmental cleaning of the school. So we're going to disinfect. If this person, basically had access to the entire building and spent time through the entire building, we might have to disinfect that. But typically, it's going to be disinfecting all the areas of a building that this person had exposure to. And then once the building's disinfected, and if there are no other cases, then the school can make the decision to reopen, working with the Department of Health. Scenario number 4 is if there is a second case of COVID-19 that occurs within the school within 14 days of that first case. So then the Department of Health is going to recommend that the school will close for 14 days, not just to disinfect, but now we're trying to reduce the possibility that spread continues within that school community. And then school personnel should conduct a thorough environmental cleaning, or again, you may contract that out to someone at a later time. So trying to make this a little bit easier for schools to understand, DPI created what they call the school decision tree. So if we have a person confirmed with COVID-19 in the building, we're going to assess the risk. What does that mean? That means, what was this person there for 1 day, or were they there for 5 days? How much of the school were they in? How many people did they interact with? It's assessing the risk means we're going to look at the totality of all of the information we have about the interaction that this person may have had with the environment and with people. Then a short building dismissal to clean and disinfect, and then contact trace in consultation with the Department of Health. This may be a couple of days, it may be 2 days, 3 days, 4 days, 5 days. That will be an individual local decision that the school will make in partnership with the Department of Health. It's not, we have to stay closed for this many days type of scenario. So if there is no community spread, okay, and when you think about it, when we go outside the school, right, there are 3 basic categories of community cases, right? There's no community spread. So in other words, we don't see COVID-19 being transmitted within our local community. There's minimal to moderate spread occurring, or there's substantial spread occurring. So what are some of the decisions that the school should consider based on what's happening in the community? And that's kind of what this is talking about here. So if there's no spread within your community, we're going to do all of those proactive things, right? We're going to have a good pandemic plan, teach and reinforce hygiene, develop information sharing systems. That's all of the information collection as people may develop symptoms, intensify cleaning and disinfection, monitor absenteeism, assess group gatherings, require sick students and staff to stay home, establish procedures for someone being sick at the school, and monitor for changes in the community spread. If we are experiencing minimal to moderate spread, and by the way, the North Dakota Department of Health will determine whether the spread in a community is minimal, moderate, or substantial. It's not like a specific number. It's based on so many different factors: population, access to healthcare facilities within, how fast the cases are growing. There's a lot of things that come into play on how they determine whether it's minimal, moderate, or substantial. But that's determined by the North Dakota Department of Health. Then we're going to coordinate with local health officials. So this is minimal to moderate. Implement multiple social distancing strategies and consider ways to accommodate the needs of children and families that may have, for example, pre-existing health conditions that make them higher risk, right? We're going to need to consider how we're going to reduce the risk of exposure to those people within our school. If we have substantial community spread, again, we're going to coordinate with local health officials. We're implement the social distancing. The difference here is that we may have an extended school dismissal. And again, that's going to be in consultation with the school district and the North Dakota Department of Health. And we might have to consider ways to accommodate those needs. And of course, this may lead to distance learning again, like we had in the spring. And hopefully schools now have a plan on how we're going to engage that in the future should the COVID-19 in the state or within an area in the state reemerge. Okay, so we're going to see if we have any additional question. So we have a question from Jason. He says, what if the student the staff member is working with has some anxiety when wearing a mask, trouble breathing, etc.? Should then the staff member just wear the mask? Jason, I would like our doctor later to address that, but also we're going to have a behavioral health expert from Nuvation Health Services on, and they actually deal with behavioral health for children, and they actually mandate the use of masks with children for their in their counseling sessions right now. So I think they could give some really good guidance on how best to deal with that. So we're going to ask them later. Jeff just gave us a question. If a large school district has multiple buildings and a case happens in one or two buildings, does that impact all the schools to close? Jeff, that's probably going to be a decision by the school district in consultation with the Department of Health. And one of the first questions they're going to ask is, did the person in question visit all the buildings? If they only visited one building and there was no exposure to those other buildings, then you may be in a circumstance where the Department of Health asks you to close that one building for maybe a 72-hour time frame to disinfect and whatnot, and the other buildings remain open. So that's probably going to be a decision that is done in consultation with the Department of Health based on that contract tracing, right, John? Anything else you want to add to that, John?
No, I just, as these cases pop up when the school year starts, understand that the Department of Health is still going to be significantly involved with the contact tracing process. That if that student tests positive, they're going to come back in and want to know, obviously, where that student has been, who's been in close contact with that person, and then they'll proceed accordingly with isolation, as well as which areas of the school are going to need to be disinfected. So you would just follow their lead, Jeff.
Yeah, and I think just to be on the safe side, I would love to, Jeff, we're going to also address that question to DPI and the Department of Health in our Q&A session, just so they might have some additional guidance to offer you on that. So now we're going to talk about the North Dakota color-coded health guidance system. So the first week of May, North Dakota departed from the federal 3-phase reopening system, and we went to the 5-level color-coded health guidance system. And we have been operating under that system since the first week of May. So what does this system actually detail, and how does it work? Well, it starts off with the highest level, which is red. And red indicates that we have critical risk for exposure to COVID-19. So significant uncontrolled community transmission is taking place, multiple outbreaks, death rate is increasing. One of the biggest factors in determining whether we're in red status is the capacity of our hospitals to deal with the patients that are symptomatic of COVID-19 and needing hospitalization, that capacity is threatened. For example, what we saw earlier this year with New York, okay? That's an indicator of red. And lack of proper supplies, okay? So that's critical risk. Orange is high risk. This is significant transmission, high risk for exposure due to widespread community cases going on. And orange is where we were back in, the second week of March approximately, when the governor first put out restrictions on businesses and operations statewide in North Dakota. At that time, if we were operating under the system, it would have been considered orange. This is kind of where North Dakota started, if you will. So under orange, we are strict social distancing, increased disinfection and cleaning requirements. We were told to avoid groups greater than 10 people, limitations for high-risk individuals, for example, people in nursing homes. People were asked to work from home if they could. Some businesses were closed, and then there was a strong recommendation to wear face masks when you had to go out into public. Yellow is moderate risk, and this is considered heightened exposure. And this is where we were up until just a couple of weeks ago. Here it's moderate social distancing. So basically we social distance when we're in crowds. Increased cleaning and disinfection. There were still some limitations on gatherings. Vulnerable individuals were asked to self-isolate, work from home when possible. And so we went from please work from home to work from home when you can, and then reconsider unnecessary travel. So that's yellow, which is moderate risk. Now, green is where we are statewide now in North Dakota, and this is low risk for exposure or transmission. So some physical distancing is recommended. It is, believe it or not mandated. It's recommended. There are recommended limits on gatherings. There are still some requirements for high-risk individuals. And all schools and businesses can reopen under green status, which again, where we are now. And then, should we continue on the path that we're on with reduction in deaths and number of cases, and we meet the necessary criteria, the next phase that we will move to is blue, which is called the new normal. Now, under blue, we're going to continue the emphasis on personal hygiene. So, for example, even if we go to blue, schools are going to ask to constantly communicate the message of how important it is for hand washing and not touching your face, and all of those covering your cough, right? All of those things that we've all been doing as part of our new processes to keep ourselves healthy, that's going to be recommended as the new normal, right? And then a big one is when we're sick, we should stay home, not go to school, not go to work. We all probably know friends and family members that have worked when they don't feel well in the past, and even had influenza or strep throat or something else. The new normal is that when we have symptoms, any of the COVID-19 type of symptoms, flu-like symptoms, we need to stay home, right? We don't need to be exposing other people to those. And of course, in doing that, we're also going to reduce the possibility that we spread things like influenza A, influenza B, strep throat, those types of things. So every school should now have a pandemic response plan. And your pandemic response plan should be based on the color-coded health guidance system. So as we move up or down those 5 levels, right, we're going to change our operations and what we do for cleaning, disinfecting, social distancing, all of those things based on what our exposure to risk is. So a good place to start is your basic facility notification. So first of all, we're going to post rules of restrictions prior to building entry. So anything that we want our visitors, our staff, or our students to be aware of under this new normal of COVID-19 exposure, no matter how many cases are in our community, we want to make those notifications and post them right on the entrances to our school, okay? We're going to post signage throughout the building on safety protocols. So we were going to stress that personal hygiene and not touching your face. And please, notify a staff member immediately if you have any flu-like symptoms. We want to put visual reminders throughout the school to notify staff or to constantly reinforce with staff and students that importance. And then we're going to educate parents on all of these new protocols. So pretty much from day one, through our email, through PowerSchool, through any other communication tools that you have with parents, we want to educate them on what steps, requirements, protocols that the school is going to implement under this new normal of where we are, so that the parents then can help the school reinforce those guidelines or requirements with their kids. They can talk about those things at home as well. Okay, just checking our questions and seeing that we have no additional ones right now. We're going to take a 5-minute break, and then we'll come back, give you all a chance to stretch your legs and whatnot. So we will be back in approximately 5 minutes.